and one which goes to the back. So one that comes in the front we call as an anterior cruciate ligament, and one goes behind is called the posterior cruciate ligament. So PC. So these two injuries can happen in two different conditions usually. So stationary, once when you are running, somebody stops you and you get rotated, and these simple movements can cause the ligament to get tear. It's not like a direct you need to get impact. Next is another one is the PCL or posterior cruciate ligament. The back ligament I said, you are going in a car, suddenly you get dashboard injury directly. So that will push the leg bone directly over the behind against the stationary thigh bone. Then you get another ligament for the posterior cruciate ligament. So we are able to differentiate between the anterior cruciate ligament, which is important for further life of a career of an athlete. Okay. So what we'll see when we get this type of injuries, we'll examine, we'll take confidence of an athlete, we'll ask what is his career as an amateur, or is he going to be a player just for a fun sometime. If he is for a fun sometime, and if there is any associated injuries. So because if this joint, in between that there is something called as a cushion, we call this as a meniscus, okay? Something in the knee, between one bone and one bone there is always a cushion. This cushion gives a very important stability for the knee. If that cushion is torn, what happens? It gives way, and that bone and this bone start rubbing each other. So that is we call arthritis in the old age people. So when that injury is there, when the cushion gets injured, then you cannot leave this a simple meniscus tear alone. So we have to intervene and stop it, because whatever the cushion which is in, once if it is torn, it will not come and heal itself. It has to be something intervened. There your main, whatever the therapy, what you are going to rely upon the patient is very important out there. So if that is not there, we will take the patient confidence, we will get a nice physiotherapy, the exercises, the building the thigh muscles, because the inside, whatever the structure, outside the muscle is also important. If you got a structure, outside your muscle is not good, definitely you are going to get injured very early. Whether it's a pivoting injury or whether a turning injury or twisting injury, anything can, simple injuries can turn to fatal by rupturing the ligaments. So, when we get this, we will take the confidence, we will bring up, we take into it, we will build up what are the exercises which he needs to get it for that particular thing. See, different play will have different exercises. We will take into that what exercises that particular athlete needs, then build it. So, for this is what we build up in the inner thigh muscles to strengthen. So that is, I said about the anterior cruciate ligament and the meniscus, what is called the cushion ligament gets stiff. The similarly same thing injuries can happen in like this. You saw this twisting. Okay, you can see here how when he goes there, when he jumps and lands up, again that twisting again. So need not be just one twisting happens. When he jumps and lands, and again on the stationary thigh, you can get twisted. So what you should do it immediately. What is our role of play when anybody injured? Anybody knows about it? What you should, somebody get injured and swelling in the knee or leg, the knee part, what you should do? Ice. There is something called RICE. R-I-C, you should believe it. RICE therapy. So what is R? Rest. Ice. Compression. E for elevation. So all these three is very simple RICE therapy will subside. These are not an emergency to worry about it. Okay, they need as well. When there is a really fall in the blood will lose out from there. That causes that tense swelling. Okay, immediately with tense swelling, we should not previously know what our school of old age people they used to put hot packs. Whenever something is there, put hot packs over the pillow. So now that is not. Whenever the hot is there, it is already there. The hot means inside the red. Redness is a hot, isn't it? The blood has come out. If the blood has come out, you need to substantiate, you need to nullify by putting in ice. Okay. So when do you put an hot? When there is an ice inside, isn't it? So what is an ice? Old injuries. Old means long, when old age people comes with the knee pain, shoulder pain, something. It is not because of injury, because it's some other different problem, long standing. That is because of a cold. So those for those people we need to put an option. So that is the one which you should know about it. When to put a heart, when to put an ice. So this is an injury where if you get type of injuries, you can rest the patients, rest the people over there and put an ice packs and put a bed compression, and next you have sufficient time. You can have a time and buy a time and direct to a nearby specialist and get next investigator what exactly it is.
So,
right?
I'm a vascular coach.
Yeah.
Like for example, the students getting interested here.
Yeah.
So we won't do the shoot, higher taking compression will be.
Yes.
And it is advisable to keep the leg little up so that the blood circulation won't go to the. It is advisable to keep the leg up and then it will be.
Yeah, it is not like not like blood circulation goes to the. The thing is, we keep the leg elevated so that the edema comes in.
So it is advisable to keep it up.
Keep the leg elevated. Okay. Your heart has got a good nicely to pump the blood to any extent. Even if you keep like this, the blood will pump. Okay. But only thing is, we keep like this is so that the swelling which has happened, intense swelling, will subside. Okay. And I have next videos to show ankle injuries how it comes. Okay. And this is very much common. This is very common in India. So most of the cases which I see injuries because of this. To bicycle, chased by a dog and get injured. Okay. So I said this is what the first patient I was talking about the ligament injuries, right? You have done enough about the physiotherapy, completely taken confidence in the patient, done the exercises, but still not able to cope up with their activities. Still they will get a twisting injuries. They will be twisting, instability, what we call. When they try to run, they are not able to have a confidence. Immediately the leg gets buckled. So this we call instability. When they have this one, so then there is no option that they have to come back to the normal sports means we have to have a small ligament reconstruction. That is the one which, if I can show you this video play showing where the ligament has been torn and how we reconstruct the ligament. See, when the ligament gets torn, God has given us enough structures in the body where we can replace one side and put it somewhere else. Okay, from our own body, we got bands, we call it bands. We got a graft band, we got a bone band, our own body. So this is the what which is the ligament. Can you see the ligament? It is torn from its spot, attachments. Because this gets attached from the leg bone to the thigh bone. But when it is attached to the thigh bone, it has torn. So usually what we believe is the old ages, what we used to do, we used to take a stitch, open it, take a stitch and used to put it back to this thigh bone. But now those things are gone. We're not able to, that will not, it's not an outdated one, it is not going to give it that original stability to the knee. So we have to reconstruct a new ligament. So where do we get a new constructed ligament? If you got a donor, yeah, XLX flexor is ready to give it one ligament from it, we can give. How many people will give a ligament from his own body to take another one? So we don't have. So we have to get it from either dead body. Okay, yeah, still there are a lot of available now. Dead bodies, there we can make a graft from there and use it for the body. So that they are all just not directly taking it. Usually they nullify all the toxic effects of the dead body and then only we use it. So this we call as an allograft. Allograft, okay? So science students, if you are not, you can just understand the allograft taken from the same species from different body. The other one is we take an autograft, that is body, a graft from our own body, where from different areas. So we take that and we harvest and give it to put it to the place where it is needed. To an autograft. So this is the one way we take it from it needs, because the ligament which is out completely has to be replaced. It's called a reconstruction because to construct the graft which is not there in this place. Reconstruction. So this is the one which is reconstructed. Not will cut, it is for the keyholes. That is where without cut opening, make a 2 holes and put the graft inside. And this is after the injury. After the injury and after the reconstruction surgery, should be able to, the first one should play and should win the match. Goal match for the tournament. And you can see I am stressing on the muscle over there. Thigh muscle. Okay. So why see athletes, they are not properly working. Either they will be very big, nutrition will be very big, but of course now it will be improving, but still not many people will not have it. Or they are not developed properly, they are properly given the training on. See this, the thigh muscle which now she had was very, absolutely was very lean. When I saw her the first time when he got injured, I was not knowing it what is squash, to be very frank. And next I was not knowing how she was an athlete today. Because when I saw her, the thigh was very lean. That means that probably that is not giving her the strength to hold any injury. So I told directly straight away, I don't think that I don't know how you are playing with a small, she got such a lean muscle thigh. She looked at that as a challenge. After the injury, after the surgery, she made it such a, but of course she had a one-to-one physiotherapist. Her physiotherapist was very easy. He used to come, he used to sit to me next to me, he used to ask what the exercise he has to do for her, and that is what it made. That means that anybody who wants to come back to the sports is a challenge. Once injured, again, next to come back, your mental strength has to be very strong, and you have to overcome that all everything to come back to the, again, you back to the pre-injury level. So that is what we need. We need to work up for that whatever we have injured, whatever the minus is there, minus we have to make as a plus. So once if it is get, you can see here the next one. She has given an interview and says that she is a better player overall now because previously what she had a minus, she had taken it to a plus. But that is most important in anybody to have a positive to come up with. You need to take the minus, convert it minus into a plus. Next I'll come to the which most, I don't know how many volleyball players are there over here. Volleyball players? No? All different people, different categories, right? So you can see how this is the injury which you were thinking about. When you have a dive, when you're landing, if you don't have proper shoes, you get twisted. The twisted can happen just with a simple sprain to fracture. Okay, and this is a very nasty one. This is a fracture. Why it happens? Because not taken properly. You can see this shoes. Okay, and this is ankle sprain is very much common. See, anybody, any injury can happen to anybody. When we walk around, when we go in a footpath, definitely we get somebody will get me knocked out by some two-wheeler or four-wheeler. Nothing is permanent. Injury can happen anytime. Anytime can happen. Accident can happen anytime. You may be flying 100 times, in a month, but anytime the plane can get crashed. So injuries can happen anytime. So we need to take a precaution. What precaution we need to take? Because this all happens because sometimes of negligence also. If you had proper shoes, if you had a good training, if you had a good nothing would have been, you can solve all this set of accidents. Okay? So precautionary measures definitely will play an important role in preventing injuries. Right?